Dr. Amanda with Straight Smile Solutions, and today we're going to talk about narrow arches. Yes, what do you do? Is this important? Yeah, it's super important, and that's why I'm here talking to you today, because it's probably one of my top 5 questions I've been getting recently, especially this month. Everyone's totally aware of airway-friendly dentistry, airway-friendly aligners, airway-friendly braces. We need to be treating our ortho cases in an airway-friendly way. And what happens when you have a patient with a narrow arch? What should you do? When should you do it? General dentists and pediatric dentists get confused, and that's where we're here for you. StraightSmileSolutions.com. If you are a patient or you are a parent and your child has a narrow arch, you need to connect with your dentist immediately. I don't care if your child is 2, 3, 4, 5. You need to connect now, and if your dentist is not willing to do something about it, or at least talk to you about options, you need to move on. So feel free to connect with me and I will find you an airway-friendly dentist near you or orthodontist. But in any case, let's talk about this. It's super duper serious and it can cause lifelong health challenges. It really can. We're finding this out now. These things need to be treated ASAP. What causes this? Now you can see here, this is maybe not the best picture in the world, but this patient generally is an adult. This patient is done growing, okay? There's not much we can do about this at this time without mostly a jaw surgery. If this patient is skeletally mature, that means if this patient could be skeletally mature at age 8, theoretically, if the patient was a girl, maybe 12, if the patient was a boy, not much you can do. There's a few systems that are launching out there, and I won't mention who they are. They're trying some new things with narrow arches in adults. Jury's still out on that. I'm not totally sure about that, but standard protocol, orthodontists say that this patient needs a jaw surgery. That means they're going to take this jaw, they're going to take the upper jaw and section it from the skull. They're going to slice the jaw in half, okay? Along with having braces. They're going to split the jaw, and then it's all going to heal back together. It's a routine surgery, but it's a painful surgery. And nobody wants to have to go through this when you can correct this at a very young age. Number one thing to do to correct it, if your child is 1, 2, 3, 4, and you're seeing that narrow arch relative to the bottom teeth, you're seeing that steep palatal vault where it looks like a cave up on the palate. It looks like you could just like stick a thumb up there. I'll bet you this child, when this patient was a child, was sucking his thumb or fingers or something. Something was in there a lot, and he was sucking on it hard, and it caused the collapse of those cheeks in and pushing that negative pressure, pushed those teeth in, and that thumb forced that palate up and just prohibited the ideal growth. The tongue doesn't know where to go. It's not sitting where it's supposed to sit when it's resting and it's taking a nap. So the tongue's going down and forward instead of up, and the tongue's not spreading that palate out, and all sorts of terrible things happened here with this patient. And this is unfortunate that this patient's dentist, not me, did not identify this earlier. So now look what happens. If you have a narrow arch, what happens? Crowding, of course, right? Because you don't have space for all those teeth to come in. What else happens? Very likely this child or this adult, now this patient's an adult, is suffering from possible sleep disordered breathing, sleep apnea, may have other medical, physical complications as a result of possibly not sleeping that well. I'm just hypothesizing here, but these things all come hand in hand. So again, number one thing, if you've got a little kiddo that has a vault like this, starting to show signs of a crossbite, get rid of that thumb habit. Check out my YouTube videos on this. I have tons of suggestions. You can always move on and see your dentist. They probably have some suggestions too. There's all sorts of next steps you can take, but there's all sorts of nice ways that you can take care of this. Get rid of that thumb, get rid of those fingers, okay? And start teaching your child to swallow correctly, okay? This will also help the child's speech, the social growth of the child. Your dentist may refer them to a myofunctional therapist. This helps a lot too. There's all sorts of options. So hopefully this helps you understand narrow arches a little bit more and why they're really important. And as always, connect with me. And if your dentist needs support, have your dentist visit StraightSmileSolutions.com. Have a great day.